Hospital planning. So definition of a hospital. Hospital is an integral part of the social and medical organization, the function of which is to provide for the population complete healthcare, both curative and preventive, and whose outpatient services reach out to the family and its home environment. The hospital is also the center for training of healthcare workers as well as for biosocial research work. Aims of hospital planning to enlarge the existing hospital by introducing new facilities. If you are a 100-bedded hospital, you want to get into the 200 category, or you want to add more departments. To increase the utilization of hospital facilities, to make sure that all the facilities are being used properly so that there is a profit margin. To increase population coverage, to cover as much of the population from all age groups, all gender, etc. To increase the productivity of the hospital. Modernization of already existing facilities. Some facilities may get obsolete over the period of time, so modernizing them as and when required. To reduce the cost of operations and maximizing the efficiency of services. Factors affecting the utilization of hospital services: morbidity and mortality of profile of the population. What kind of population are you serving? If you're in a tropical environment, you have to serve a population based on the endemic rate of vector-borne diseases. So, for example, availability of beds. How many beds do you have already in your township? How many large-scale hospitals are there? How many small-scale hospitals are there? Bed distribution. How many beds will be distributed for ortho patients? How many will be there for medical patients, for surgical patients, and so on. Demographic profile. The age. The age group of the patients you are serving a lot. If you are getting 1,000 patients per month, what is the most common age group which you are serving? Availability of hospital services. How many departments do you have? Do you have all the radiological services? Do you have all the most of the tertiary care services or not? Availability of other hospitals in the vicinity. In your near radius, who are your competitors? How many other primary healthcare or secondary healthcare centers do you have in your township? Financing of healthcare. Who is financing the hospital? Is it a public private partnership? Is it a private hospital or a public hospital? Availability of specialist services. How many specialist services do you have department wise? Family system. Do you cater to the needs of the family? Are you treating the patients who are dependent on the existing family, or you have to cater them as a family system or not? Customer care services. How is your social services, the customer care services, is it satisfactory? Professional management of the services. Hospital services are managed professionally. That has important impact in the utilization of the hospital services. Technological updating wherever it is required. It has to be updated, otherwise your technology may become obsolete. Economic status of the people you are serving. Are they from low income families, middle income families, higher income families? Transportation. What kind of transportation is extramarital transportation is available in your area? Communication. What kind of effective communication system is required in the hospital? Supply of manpower. How many educated manpower in respect to doctors, nurses, paramedics, and other grade 4 workers? How many is required? So these are the factors that will affect the hospital planning. Type of hospitals. According to ownership and control, you have public hospital, voluntary hospital, nursing homes, corporate hospitals. Then, according to the directory of the hospitals, you have general hospitals, rural hospitals, specialist hospital, teaching hospital, isolation hospitals. Systems of medicine, you have hospitals, Ayurvedic hospital, homeopathy hospital, allopathy hospital, allopathy being the most common one. According to the size of the hospital, if the bed number is less than 200, it is a small hospital. Between 200 to 500, it's a medium hospital. Above 500, it is a large hospital. According to the clinical basis, is it a general hospital or a specialized hospital? For example, of the Netralaya is Narayana Netralaya would be catering, is a specialty hospital based on the ophthalmology. Narayana Hridayalaya NH Healthcare based on the specialty of cardiac health. So on. According to the level of care, primary care hospital, secondary level hospital, or a tertiary care hospital, or community care center. According to the teaching facilities, is it a research hospital or a medical institute? based upon accreditation, JC accredited hospital or NABH accredited hospital. Based upon the gender, is it a maternity hospital, uh, a maternity and pediatric hospital or not? According to the length of stay, some hospitals will be on palliative care hospitals. Some hospitals will be catering to the cancer patients. So based on that length of stay, length of stay is much higher in a cancer care hospital and palliative care hospitals. Hospital planning process. Conceptualization of the hospital is the first step, where the originator of the idea has given an innovative idea to the community. Now, the imagination or the idea takes into practical shape. At this level, the originator compares his dream with the existing hospitals of the country or outside world, and tries to fit his dream into any such project, or if it is really innovative, may far exceed all such existing ideas. So here just the conceptualization hospital means the visionary has an idea that I want to build a hospital. So that's the first step, conceptualization of a hospital. Support groups. Here, in search of like-minded people, discuss the project, convince them to be the part of this visionary hospital. Some people may get ready to join hands and heads to complete the project. So this is where you find the support groups. You find funding agencies. You find people who want to support you into making your conceptualization into practical reality. Feasibility study and survey of the community will be conducted to make sure that it is not make sure before jumping into the construction that it is not a loss making entity. You may generate enough profit from this. So feasibility study will be done based on community diagnosis, SWOT analysis, environmental analysis, etc. Organization of the governing board. You will decide who are the stakeholders who are the core group, who are the board of directors of this hospital which is going to exist. Hospital zones, how many hospital zones we will have, from clean to sterile, etc. Engineers, uh, you will get along with the engineers to discuss about the architectural plan, and all the other engineering related discussion will be done to understand what facilities should be rendered in this construction. Hospital project management will be done based on by which time it has to be start functioning, what are the deadlines, etc. Circulation, you will decide what kind of transportation will be used within the hospital, extramural and intramural. Hospital project cost, what budget allocation, resource allocation. Construction of the hospital will take place, then the physical construction will take place, then hospital commissioning. After construction is done, departments are set, you hired new people to run the hospital, commissioning will start. Scheduling of the services, what are the OPD hours, what will be the OT hours, what will be the OP radiology hours, etc. Inauguration of the hospital, the inauguration function will take place. Shakedown period, it is a learning period where obviously when you start a hospital, it is started functioning for the first time, that will become, there's some hurdles or some mistakes and some barriers may come in the smooth functioning. So in the shakedown period you will learn about it, how to overcome this. So feasibility study, survey of the community. This will help us to determine the viability of the project, like doing either by doing community diagnosis or environmental diagnosis, also called as SWOT analysis. So in community diagnosis, morbidity data, mortality data, environmental statistics, demographic data, institutional data, data on socioeconomic status of the population, data on other sectors, all these data will be checked in community diagnosis. It's morbidity data, what are the rate of prevalence rate of communicable diseases, non-communicable diseases, rate of accidents, road traffic accidents taking place, lifestyle diseases in your area. Mortality, what are the crude death rate, age specific death rate, maternal mortality rate, infant mortality rate in your area, life expectancy at birth, all these data has to be done. Then environmental statistics will be done, percentage of the people who have potable water, people who have what are the percentage of the people who have basic sanitation in your area, environmental monitoring data. This will be checked in environmental statistics. Demographic data, age and sex structure of the population. What age group is the most common in has the majority in your population? Marriage rate, population density in your area, migration, extent of urbanization, economic status of the population, etc. Institutional availability of your competitors, availability of other hospitals in the area, types of hospitals available, hospital utilization indicators in the vicinity, total number of hospital beds in the entire district or state. Such data has to be collected. Data on socioeconomic status, what are the average family size, dependency ratio of the people, literacy rate of total male and female has to be tallied. Data on other sectors, for example, availability of other institutions like school, bank, cinema, theater, market, and electricity supply, railways nearby, transportation methods nearby. Those will be the data on other sectors. Then we do the environmental analysis, and environmental analysis you have to do internal environment analysis and external environment analysis. And external environment analysis is called the SWOT analysis. In internal environment, you will see the strengths and weaknesses of the internal environment, that is the strengths and weaknesses of your staff, the expertise, the turnover, technical manpower, retention of staff, job satisfaction among your staff. These are the factors which will affect the internal environment. External environment, SWOT analysis is done, that is strength, weakness, opportunities, and threats will be analyzed from the external point of view for your organization. Organization of governing bodies. It depends from hospital to hospital how the organization will be done in the governing board. For example, first here the first tier is made up of the hospital consultant, then medical administrator, financial experts, legal advisors, hospital engineers, hospital architect. They come in the they will form the organization while hospital is under construction. Then hospital zones, outermost zone, which is the most community oriented area, OPD and everything will come under here. Second zone receives the workload from the outermost zone, that is the OPD laboratories, OPD radiology department, etc. Middle zone, it is between outer and inner zone, and that is like getting admission procedures will start here. And inner zone, it is an interior but with direct access for the public, that is the all the wards, general wards, specialty wards will be situated in the inner zone. Service zone disposed around the service yard, CSSD, OT, etc. Project hospital project management, collection of data by planning team for community diagnosis. First, you collect all the data which we have discussed earlier in the community diagnosis, that is morbidity data, mortality rate data, institution data, etc. Then selection of the site of hospital, you will select the site where you want to construct the hospital. To prepare a master plan on how the construction should be. It should be east facing, north facing, whatever is the direction you want to place your hospital in. Preparation of the functional brief or the architectural brief. Architecture will be included here. They will give their brief. They will give us short notes. Architecture brief contains of short notes based on the master plan, wherever changes required to be done, etc. Thank you.